Hey everybody, it's Karen Anderson here with Aortic Hope, and we have a very special live event tonight because we are also presenting for all of you at Rock from the Heart. So while we couldn't be there with you together in person, we're excited to share this live event in our community collaboration with both Aortic Hope and Rock from the Heart. So I'm going to introduce Amy Wagner, LCSW-C. We've had her here many times before. She's a fan favorite. And I'm going to let you go ahead and tell everybody a little bit about yourself before we jump right in.
Okay. Hello, everyone. Thank you for having me back. And I look forward to our discussion today and tonight. Um, as Karen said, I am a therapist. I've been in the field of social work for 33 years, but specifically the majority of my career has been in private practice, specifically in the area of trauma. And so that's my passion. That's kind of where my main emphasis with my practice is. And I look forward to our discussion tonight regarding that.
Well, we're always so excited to have you here. As you know, and for those of you who are watching us for the first time, before we even get started, please remember to click like, click subscribe for those of you that are watching on the YouTube channel. For all of you sitting out here in the public watching, we're going to get started right now. So we in the community, we're in the aortic disease community, but really everything we're going to talk about is applicable to anybody. And I think one of the first things we should talk about is we've often limited our conversations to PTSD. And I've had a lot of new terminology thrown around in the community, such as medical trauma or just PTS, and throwing off the D. So let's talk a little bit about what is medical trauma.
Medical trauma, while that's not necessarily a diagnosis per se, it is now being used to set apart a particular traumatic situation from other traumas, because medical trauma comes with all some different types of issues related to that. And so we're using that term more and more to kind of set apart a specific type of traumatic experience specifically related to anything in the medical area or just health issues related. So,
okay.
A little bit different.
People in the aortic disease community tend to fall in a couple different categories. One, we have caregivers. So
Yes.
they kind of oversee both of the other categories we're going to talk about. There's also people that have been diagnosed with a form of aortic disease, whether it's a bicuspid valve or they have an aneurysm. And then there's been those who have experienced an emergent event, such as an aortic dissection.
Right.
So let's talk a little bit about anybody in this category can experience medical trauma. Is that correct?
That is correct. Yes, absolutely. Absolutely.
Okay.
And it's because I'm working off of the definition of trauma as being an unexpected or sudden event that pretty much overloads our brain and overloads the brain circuits to manage that situation. So with a health crisis, most of the time that could be an unexpected or sudden type of occurrence, like the dissection or that sort of thing. So that's the definition I'm working from.
And then I would suppose that somebody who finds out that they have an aneurysm and they're in that watch and wait category, it's almost on repeat of potential medical trauma because they're just waiting for a shoe to drop. And it's how do you manage all of those emotions? So that would fall under medical trauma as well.
Absolutely, yes, because they are repeatedly having to live with the constant possibility or fear that it could go into something more sudden or more critical. So it's always there. So
now, if you've had a diagnosis or if you've survived an aortic dissection, are you still able to benefit from receiving therapy while you're in the midst of still having all of these emotions? Because I don't think this is ever especially with medical trauma, something that just happens and you're one and done and it just leaves. And that I say that because we're taking our blood pressures every day. We're cognizant of how we're eating, how we're living. We're feeling symptoms that may or may not be related. So is somebody that's involved in a day-to-day still able to benefit from some type of therapy?
Absolutely. And I highly recommend it just to learn some different ways of managing and coping with that. I mean, a lot of people have the basic coping skills that get them through, but these medical type of areas really just challenge everybody's coping skills. No matter how functional you feel you are, when you're under that, it's a challenge. So I think counseling specifically can help build upon what you already have there, or also offer you some other ways to handle those situations.
Now, one of the toughest things I think that everybody in this community and in any medical community comes across is the emotional mental impact of having a medical traumatic experience occur. And we all seem to define trauma differently. I think we're in a lot of denial, and this is just a surgery, I'll be fine. Nobody explains to us, at least not many hospitals, take the time to say you're going to feel more than just the blues because of anesthesia. So we tend to go home after a diagnosis or after a surgical procedure, and we may not be aware that we're actually suffering from some type of trauma or PTSD. So, what would be some of the symptoms or ways to maybe make ourselves say, something seems a little bit off other than just being a little depressed that I'm trapped in recovery? What would be some things that we should look out for and then have that conversation with our physician?
Okay. Um, I'm going to break it into two different categories. You're going to have the triggers to look for, and then your symptoms to look for. So your triggers are things that tend to set off a chain reaction, say, so to speak, to something. So a trigger could be just every time you walk into that particular doctor's office, um, something comes over you, or you begin to have a symptom where you're feeling sweaty or panicky or that type of thing. So these triggers go hand in hand with your symptoms, but pay specifically attention to things that seem to set that off. It could be the smell of the office, it could be the sounds of things like beeping noises, it could be the lights that set things off. It could be just having to be touched in a certain way, or having the exam done. Just I've had some people just having to put on the exam gown get you into a certain, way of feeling. So once you're able to identify your triggers, then you can pay attention to your symptoms. Are you zoning out? Are you numbing out? Are you dissociating to some degree? Have you found that you're not sleeping? Are you having more nightmares? Are you maybe using substances more, drinking more? Are you having stomach issues because of the anxiety? So I think paying attention and connecting those dots will help you identify that this is actually trauma. Not all trauma turns into post-traumatic stress, but it really has the potential to turn into that. So I think you have to pay attention to the early warning signs ahead of time.
Now, what makes it different? What then crosses that line and moves one into the post traumatic stress area?
When you start to notice that you are having repeated triggers, and you are responding to them in a unhealthy way or a more increased way, like panic attacks or just feeling sweaty, or some people I've met with have actually taught themselves to just kind of pass out to avoid that exposed feeling. So I think once it has moved into you're getting triggered all the time, then that's your clue that it has become more a PTSD situation.
Okay, so if you are whether you're in the doctor's office or if you are driving and you see an ambulance and you find yourself
Yes.
in park. Not that I would know that firsthand, but
Yes.
if you see the helicopter overhead and you're starting to become maybe even obsessive compulsive about I have to track that. Okay, now we
Yes.
can continue. If you are someplace and you know, I've known people that have been at the dentist and they see everybody coming at them with masks and they start hearing what they think are heart monitors, and that doesn't exist. That's clearly not there.
Good
And
example.
just
Yes.
right, and just the way that you're reacting, that should be enough to say this is a little bit more than the blues after a
That's
diagnosis
right.
or surgery. Okay.
That's right.
So
Yeah.
then you would what, have the first conversation with a general practitioner, or would you just immediately go searching for a therapist? Which one would you do first?
I would bring it to your doctor's attention first and see too if there's anything they might do to um, be able to intervene in that in a different way so that it's not so difficult.
Okay.
So many times I think, of course, doctors are focused on the medical piece and life-saving measures and all of that, and perfectly understandable that they're not thinking about the psychological effects that it's having as well. And especially for like those that have experienced like a dissection and had emergency surgery, that's a life or death situation. So the aftermath of that is we just need to keep this person alive and all of that. So they're not always connecting that the psychological issues are taking place at the same time. So,
And I think that some hospitals are really starting to take notice because people are going to their physicians. And I know Maimonides Medical Center out of Brooklyn, New York, they're actually doing a research study. They've been doing it now for at least 2 years in a row, where they are gathering data from the community, from people who've had dissections, from people watch and wait a year out, 5 years out, it doesn't matter, to kind of check in and say, hey, you know, what has been happening with you emotionally? And so I think people are starting to take notice. But the key is if you see it, you should say it. You need to say
and,
something.
and we've been trying as a practice, a field to try to bring that to light in and more with more of the younger doctors that are coming through med school, really trying to maybe get them to take more psychology classes or things of that nature so that they do make that connection. And a lot of the practices that they start up can begin to address that. We've started seeing that more with doctors now handing questionnaires out to their patients so they can kind of gauge how anxious they're being, how depressed they're being, and then make those referrals for further treatment for that. So it's happening. And even though we'd like to see more of it and it happening faster, the fact that it's happening is encouraging. So,
Okay, so now someone's made it to their doctor or they've made it to a therapist, because I know we're going to talk about certain types of treatment need people with special certifications in order to treat in certain manners. So somebody's going to come in, and there's a couple, I'm sure many different ways. I've heard of art therapy. We know CBT or cognitive behavioral therapy. We're going to talk about EMDR. Let's get into some of the different ways that somebody who's now been diagnosed with either medical trauma or PTS, what are the different ways? Because I think a lot of people have this misconception that they're going to go to a therapist and lay across the sofa and someone's going to say, so how did that make you feel? And that's
right.
about all you get out of it. And it's like, that's not what it is. So please,
No.
Amy, tell everybody all the different options and save EMDR for last.
Well, and a lot of times I'll have clients come in and their complaint is that they've been more and more anxious and they're having panic attacks or something like that, and they're not even connecting it to what they've just gone through.
Right.
So a lot of times the first part that really is helpful is just realizing, I'm not crazy or I'm not losing it. There's a reason for this happening. And there's a lot of relief that comes from just being able to make that connection. And sometimes, too, because they don't want to necessarily upset more family members or overload friends by talking about it so much. Um, Counseling can be just a really good outlet to just let it all out, express it all, just release all of that you've been holding in as well. So that's where talk therapy really can be useful and make those connections. And then we can offer options of, well, have you tried this? Or what do you think about doing this instead of? And just advocating too, like when you go and have your blood drawn, talk to the phlebotomist so that they know that you have issues with needles, or you feel uncomfortable, or you've been poked and prodded so much that you have some concerns about that. So it's advocating for yourself. So there's a lot of behavioral teaching type of opportunities with.
I'm not sure if this feed has frozen or if it's just on my end. Oh, there we go. Well,
but there are those that still are having issues that they just can't get past a certain part of the experience.
Right.
And that could have been like the emergency piece of it, or even to the point of, we've had some people just telling all their family members goodbye because they weren't sure they were even going to survive the surgery. Or so when it gets to that point that they just can't work past that level of critical need of it all, just the life and death type of issue, that's my indication that there's something that is stuck in your brain's ability to process all that took place. So that's when I like to utilize some trauma tools, and one that I specifically use a lot is called EMDR, and that stands for eye movement, desensitization, and reprocessing. And it's a fantastic technique that helps to kind of unplug that trauma from one part of your brain and process it into your memory files in a healthy way, so that you come away believing something more positive about yourself through that experience. So I'm happy to answer any questions about the EMDR if you have some further. But
oh, you know what I love, and it's no secret that we've worked together. I have no shame. I share anything about myself. And you're right. One of the things that really came out when we first started talking, because it was very evident that talking and trying to flip my own script and change my narrative about how bad and tragic it all was, and I was so stuck in what if, and this could have happened, and what if, was learning how to advocate for myself and learning to accept I was going to have many potential trips to the ER. And
right.
How do I explain to people I can't have 5 people over top of me asking a million questions? I have to be able to say, without feeling embarrassed, because this is part of the health journey, I need one voice or I'm going to shut down and I won't be able to answer anything. And the first time I did it and they listened, I thought, now this is great. This is a great doctor's experience. They're listening to me. They truly they truly were. And the second thing was the EMDR. And what I love about this is I heard about it from another community member, and I would never have believed it would have worked in a million years until we did this together. And your analogy of a computer at the end of the day downloads information during REM stage, which is the eye movement, right?
Right.
And when you have a traumatic experience, it just doesn't download it properly. So you can see a car accident, it gets downloaded, but you see a car accident with somebody who flies out the window, it might get downloaded with a whole other different set of emotions, because that's different. Yeah. I'll never forget. I forget a lot, but this I never forgot. And it was a very big visual. And then when you're doing EMDR, you're mimicking that REM stage, whether it's through a light or finger. With us, we were holding paddles. So my eyes were closed. It was comfortable. You hit the zapper left and right, doesn't hurt. It's just a vibration. And I had an opportunity over many weeks to think about different moments that occurred. And in thinking of that to a forced REM stage, that's where you're not asleep, I was able to download that information like I would have at nighttime. But I
That's
knew that if I just winked and opened an eye, I was still in the safety of your office. Nothing was going, not that it hurt me, it saved me, but all of a sudden everything came to focus that I wasn't hurt, I was saved. The ambulance wasn't scary, it was life saving. I was
that's
never flown in a helicopter, you know what I mean? And
yes,
I
yes.
wasn't smelling alcohol. Remember there was a time when you tried to unwrap a packet of alcohol and oh, I was so irritated.
Yeah,
We were trying to desensitize me and it was like, well, I'm not ready for this, but
that's a
you know,
exposure therapy.
oh, I'll do that, but don't expose me to spiders. Anybody who knows me knows that that therapy would not have worked. But I think again, the interesting thing of EMDR is it's scientifically proven, right? They've been doing this for years,
That's right.
and
Yeah.
it's
They
it's
have a
it's
lot of good research
right.
behind it.
And I think the other thing that we came away with that I was wanting to ask you about is sometimes it's not exactly what you think it is that was most traumatic. You might uncover through this that this might even go back further into things, and it's not hypnotherapy, but you might start, your mind might shift and wander. And next thing you know, you're realizing, well, wait a minute, it was when I was in fourth grade that I got a
That's
needle
right.
that hurt. And this is where,
Yeah.
right. So can you elaborate on that a little bit?
So what happens is what we realize when sometimes when a particular part of a traumatic event really seems to bother you a little more than what we would realistically think it should. Sometimes it can be connected to something that happened in your past that never got processed completely. And if it happened to you when you were a small child, you may not even have had the skills or the maturity yet to be able to process it. So it just sat there. So what's really getting triggered is not necessarily what just happened to you, it's triggering something in the past. So many times we may not know until we get started with it that what we start with is actually going to take you back to remembering something very earlier on. But that's the beauty of the technique is it does that and it solves it all. You know, it has that rippling effect with it. And so healing takes place in more than one way, but there is the potential to, yeah, tap into something further back. Mm-hmm.
And it really does. And this, I'm not sure if it's EMDR or more cognitive behavioral therapy, or that would help address when we as patients, we have guilt, our lives have been changed, we now have our loved ones on edge all the time. If we've had a major surgery and we can't go back to work, what has that done to the way our home looks like? We may not be able to provide financially. We look at ourselves as a shell of our former self. And then you have caregivers who, if we don't answer the phone, they're really concerned that we're in a ditch. I mean, this is what you heard when you were 16 and got your license, but now it's really potentially applicable. And they're worried and scared. And so there's all these dynamics. And this is where I just think therapy really can come into play to help iron out these wrinkles in our lives.
Yes.
And they actually can, it helps, it doesn't hurt. But once they've done this, is there such thing as coming back for a tune-up?
Yes. Um, I mean, one thing with EMDR, it does in one or two sessions what it could take weeks and months and years to get to. So once someone feels like they're at a more healthier place, more stable in their symptoms, we've seen those symptoms decrease, then I would back it off to, once a month and then just keep working it out from there. But I think it's always good to come back in, even if it's every 6 months or once a year, just to have a reassessment of where are you at now? Is there anything new that is, coming up that you may not have made that connection with? And just checking in, because I think it's important. Because a lot of times, you may feel like, well, I'm already going to so many other doctors and everything, and then therapy can tend to take more of the back seat. But I think something to piggyback on what you were saying about caregivers, I often encourage spouses and parents and children and all to come into therapy too. so that they can also learn how to manage their fears and concerns and their now new heightened level of, guardedness or protectiveness. And yeah, the patient many times can feel like they're a burden on the rest of their family, but the family may not see it that way. They just want to make sure that they're doing everything that they can do. So I don't just see it necessarily as just the person who is having the health crisis. It's not just their problem, it's the family system as well. So when we can benefit by getting everyone else in, that's good too.
And some of the other things that I know we've gone over before, just as an added component to actively going into therapy, would be learning grounding techniques. And we've talked about this often, how to utilize your five senses. So it's not like you have to go shopping for anything, it's all right there in front of you. And learning how to, when you feel a trigger, use your sight, your sound, your taste, your smell, your touch. If you want to go over that just
Right.
a little bit as well.
If you're having like a panic situation or a stress reaction, or even if you're getting ready to go into a doctor's appointment, just to try to help you stay focused. So I always say, just look at your hand and think of one thing you can see, one thing you can touch or smell or feel or taste or hear, and focus on one of those five senses. And just, if you look out the window, look at the trees, how green they are, or how this and that, so you can kind of work yourself down. It's kind of like a mindfulness type of technique to just help you stay at a certain calm level, and bring those symptoms down. So, and I recommend grounding techniques. I mean, like you've said in the beginning, you can use these techniques for anything,
Everything,
not just for
anything.
a medical issue or whatnot. But so that's just a small way, but a very helpful, effective way. And you can do that just even if you're sitting in the waiting room, or you're in the exam room waiting, or you're waiting to have your blood drawn, or another scan, or whatever it might be. That those are some good ways to kind of try to relax yourself. So.
And it really ends up being a relaxation and distraction technique. We've also talked about counting in multiples, or when I go into an MRI machine, I try, it's so embarrassing. I try to replicate the sound of the machine. And next thing you know, I'm asleep, or I'll start to count how long I have to hold my breath in a CT scan, or I'll count 1, 2, 3, 4, 4, 3, 2, 1, and I just keep doing that. And I don't realize what's going on by the time I'm done, especially if I try to count in multiples of twos or fours, or be daring and go higher. I'm lost by the third one. I don't remember what number I was on, and then the episode's over. So these are all just ways to distract your mind from what you are perceiving as something that's going to create anxiety.
That's right. You can sing a song in your head. Some people are more tactile, so they might like to bring something with them. I've even had some that like the Velcro, and just rub that, or now those you've seen those little pop type of little square things. Just anything like that that helps you distract yourself from what else is going on.
Fidget ring. Maybe
Yeah.
there is something to that good old rabbit's foot that we used to collect back in the 70s and 80s.
Right.
All right. I'm going to take a minute and see if we have any questions in the community, and see if there's any thoughts out there.
Okay.
Just remember, they're going to be maybe 15 or 20 seconds behind us.
Okay.
And
So we need a couple seconds.
I would like to make a comment, Amy.
Please.
When you said bringing in the families, in our caregiver support groups, I get to hear a unique perspective from the caregivers only, and it is remarkable how many of them realize that they are also suffering post-traumatic stress.
Yes, that is very true. Very true.
Well, I know I experience it, and I'll never understand what my family members experience when this happened to me, and they're never going to understand what I feel. And we just had to get to this point where it was okay. And when I would hit my aortiversaries, as we call them in the community, which doesn't mean you've had a dissection, it can mean anything to you personally.
Right.
After the first year, everybody was gung ho. They were like, let's go out. I wanted presents. It's my rebirth day. Year 2, nobody wanted to go. And that was very disheartening. But I realized I live this every single day. So do they. And they don't want to have to make a big deal every year. They are remembering this very differently than me. So I just started going out with friends. And then I said, okay, well, every 5 years we have to actually celebrate. And they said, fine, we'll agree to that. So
Oh, that's
I'm
nice.
coming
Yeah.
up on 8. I've got 2 more years before I can pull everybody in. But
That's
and I
awesome.
respect that.
Really is. Yes.
Yeah, I do. I respect that they're dealing with their own flashbacks, and we do talk about. I think talking about it is healthy, and
Yeah.
asking family members, what did you feel when you heard this diagnosis? What do you feel when I go for a scan? What did you feel when I had a dissection? What happened that day? What were you thinking in the
Exactly.
waiting room? It gives everybody perspective.
Yeah. And I think it gives them an opportunity to be asked, what can we do to help you as a caregiver handle this? What do you need from me, or what, that sort of thing. And it might be simple as answer your texts a little bit faster if you can, or check in with us, or things like that, because they worry. Yeah.
And I don't know, Josh, when you've been in on the caregiver group, and I'm not going to ask you too many questions because they have their own private group for a reason, but I think that in different levels of your recovery, during your recovery and management of this in different stages, we go through a variety of emotions. Like I mentioned before, feeling guilt that we can't be who we were, or that we're just worthless and life doesn't look like it did, and all of these things. But it's so crazy because the caregivers, they don't think that of us at all. They're just so happy that we're here. And I think most times than not, they just feel so stuck that they can't, it's one thing that they can't truly fix beyond being an advocate. They can't take the pain away. They can't take our own anguish away, and they feel torn. And
Well, and I had a client where I spoke with the husband, and he was not sleeping. It was really becoming a problem with his job and everything, but it was because he was waking up often during the night just to reach over and touch her and make sure she was still breathing, or still, so I guess so it was helping him learn how to manage that. And we came up with some other ideas so that he wasn't exhausted just from the worry and lack of sleep. So she had no idea that was going on, but he didn't want to worry her anymore. So, I mean, communication changes a lot when someone has gone through this, and I think it has to change in order to help one another through it. So definitely we need to support our caretakers too. Yeah.
yeah,
For sure.
yeah. All right, I'm going to check back in again just to see if we have any questions.
Let's say hi to Rob Seltzer. He's doing great.
Hey, Rob.
And
Good
Hello.
to hear it.
Karen Heichel says hello. And
hello, Karen.
She's not getting our emails, so I'll have to find out what's going on there.
Okay.
Yeah.
Technical difficulties and issues. Well, glad to know that you're out there. If you have any questions, let us know.
Yeah, and we have 10 viewers, and it's been fluctuating between that and around 50.
Wonderful.
Yeah.
Well, we're so excited to be able to have you participate in this with Rock from the Heart and with Aortic Hope as well. I know that we've been able to really utilize your skills and ability, not only talking about what we go through from an EMDR post-traumatic stress perspective, but just also from just ways that we can communicate and change the narrative about our own self. Now, 8 years past when this happened to me, I feel a lot differently. I feel very different about myself and what happened in the beginning.
Can't believe it's been 8 years already.
Can you believe it? Isn't that amazing?
That is amazing.
Yeah, and it took some time to just accept I'm kind of retired. And when the days now happen where I'm not feeling well, I'm so happy that I don't have that added stress. But it takes a while to get to this place of accepting your new norm. And we've talked about that before, a terminology that's not well received sometimes in the community. or by any medical community when you have to settle in to your new norm. But that's what it is.
It's the new reality of this. You know, your life has changed forever in a different direction. It doesn't mean you can't enjoy life anymore. You just have to do things differently. But I think just by natural default, it's going to change your perspective on living. But that's not always a bad thing. But it definitely, it's an adjustment to do that. So I think we all need to support each other in that as well.
We do. And I think you either come out of something like this with an immediate, instant attitude of gratitude for the life that you have been given, your second chance, the fact that doctors caught something and they're able to fix it, whatever the case may be, whatever your scenario is. We either come out right away with that, or we do tend to struggle before we can come out on the other side. But ultimately, coming out on the other side really does help you overall feel and be healthier, a healthier version of yourself. All right, we are coming up on that time. And if there aren't any other,
definitely.
Absolutely. If
Everybody
there aren't any
has
other, I'm
their
sorry,
own
go ahead.
journey experience. And,
yes.
We can't compare ours to theirs. They can't compare theirs to ours and feel like, well, I'm doing it wrong. And they, you know, everybody has to be allowed to go through that in their own way and what works for them. And so that's why I encourage anyone to at least go and have a mental health assessment after something like that. And I'm hoping now doctors are more tuned into that and are recommending that as part of the treatment plan, is please go and take care of your psychological part of this as well. And,
I would love to see, there's no sense, if you have open heart surgery, to have a social worker come in while you're there with all your tubes just been taken off a breathing. They're not going to assess anything but somebody who's so drugged up. But after your first clinic visit, if your doctor doesn't suggest that you do, as you just said, have a checkup for your mental health. I mean, we're going for all this other checkups. We're meeting with our primary cares immediately after, our cardiologist, sometimes the surgeon again. If it's not suggested, I would highly recommend that you seek to do it yourself. And I think people don't give enough credit to the brain and what it can actually, the havoc that it can wreak in your body, basically. You know, and it happens.
I mean, having a positive mental health outlook will have a lot of effect on your healing and your how your body functions. So we're really working hard to get those protocols put into place with doctors for all kinds of reasons. We've even, you know, for example, talked with a dentist association to assess that with patients, or assess substance usage, but assess if they might need a mental health referral. So it's in all different facets of medical, but especially after major surgeries, I think that it only stands to reason it's going to affect someone psychologically.
Exactly. All right. Any other questions or comments or shout outs?
No, we have a quiet chat room.
All right, quiet chat room tonight. I know it's raining here. It could be raining just about everywhere.
We've done a good job then.
We did. Everybody they just feel complete with the knowledge we've given them. Amy, thank you so much again. We so appreciate this, being able to give this presentation and educate everybody on medical trauma, on the potential symptoms of that, or PTS. Of course, you can't diagnose yourself, but giving everybody the tools basically to advocate for themselves and have that conversation. And I love that you've enlightened everybody with the various different types of therapy that they can receive as well. And one thing to mention, EMDR is not found with every therapist, correct?
No, that is correct. It does take some additional training to learn that technique, and so you have to really ask around. There is a EMDR website you can go to that has a list of available EMDR therapists, but feel free to give your audience my name and information. If I can be a resource to help anyone find a therapist or provide that, I'd be glad to do that.
Thank you so much. You're always so wonderful. And thank you to all of the Rock from the Heart attendees near and far, and to all of our community members in Aortic Hope. We appreciate you sitting and listening. If you have any questions, you can post them in the comments section of this YouTube. Thank you so much, and we'll see you again soon. Take care.